Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, the government restricting travel to and from Metro Manila.
Community quarantine is hereby imposed in the entire of Metro Manila.
In its bid to contain the coronavirus spread.
Ayaw namin gamitin yan, pero kasi takot kasi sabihin lockdown. But it's a lockdown.
How will local leaders secure their borders?
Land, domestic air, and domestic sea travel to and from Metro Manila shall be suspended.
But the president clarifies this is not martial law.
It is not a martial law. It's not even something extraordinary.
MMDA General Manager Jojo Garcia, Marikina City Mayor Marcy Teodoro, and Cainta Mayor John Nieto join us live. Thank you for joining us. I'm Pinky Webb. President Rodrigo Duterte has put in place travel restrictions to and from Metro Manila after health authorities raised the highest COVID-19 alert level. The president says the region will be placed under community quarantine from March 15 until April 14. Over 12 million people will be restricted to travel to and from the National Capital Region. But how will local leaders implement the community quarantine? Let's go straight to the source of the story. We have MMDA General Manager Jojo Garcia, GM. Welcome to the show. It's good that nakarating po kayo dito.
Hi, good morning, Ms. Pinky. Good morning to everyone watching the source.
How do you guys call it? Do you call it a lockdown, travel restriction, community?
Actually, the term that they want to use is to slow down. No?
Another
slow
term?
Down. Yeah,
Okay.
slow down yung Metro Manila, no? Yung movement sa Metro Manila. Kumbaga, we need to check kasi what's the really main purpose of this? Of the slowdown, or you want to call it lockdown, or community.
I actually want to call it what government officials want to call it, sir. Because in the memo,
Yes.
hindi naman po nakasulat lockdown. Pero sinabi po ni Pangulo kagabi lockdown. Hindi po ba?
Yeah. Some sort, no? Kasi nga, sabi nga, pag lockdown, parang iba nakinulong ka sa bahay no? Na yung mobility ng tao mawawala. But you're allowed You're allowed to go out, no? Ang ano lang natin dito is yung prevention kasi. Wag na natin isipin yung guidelines, bakit ginawa, bakit ganyan, ano nangyari. Kailangan isipin na lang ng tao, paano natin may iwasan.
And what are we going to do?
Yes.
Hindi ho ba?
Yes.
Because the president already ordered this,
Yes.
which will begin on March 15.
Yes, on Sunday.
Yes. Ang importante po dito, GM, ay kailangan natin parang malaman yung fine print nitong
Yes.
inutos ni Pangulo. What do you know so far? I mean, are you gonna go, marami na ho ba kayong alam kung paano ipatupad itong tinatawag niyo pong slowdown?
Actually, on this lunchtime, no, there will be a meeting na para sa, kumbaga, IRR. No? Ito, nag-meeting yesterday, ito yung dapat gawin. So, sinabi ng ating Pangulo na itong dapat natin gawin. Then yung paano gagawin, ito na yan, yung today. No? Kasi kaya nga Sunday may time. No? That's why even the mayors, no, we have a Viber group with the NCR mayors. So, were asking me, ang una nilang tanong, paano yung mga pagkain galing from vegetable from Baguio, ganyan, no? Sabi nga, maganda, nag-interview si Secretary Anyo after that. Ang sinabi nga, of course, pwede yan. No? We should not be very literal about this na ito bawal. Pwede yan, pagkain yan Sabi nga, yung supplies ng food, mga ganyan, pwede yan, of course, no? Supplies ng medicine, kung yung mga alcohol ba, disinfectant, galing ng Bulacan usually yan, babayayan, of course, pwede yan. May nagtanong naman, dadami ng pilosopo no? Sabi nga, dumadami ang expert no? That's why I'm warning everyone to be careful, lalo na sa mga fake news. Ano? So, example, sabi na, taga Bulacan, taga Cavite, papasok ng trabaho. Of course, pwede. Sabi nga ni Secretary Anyo.
Let's clear that. Let's clear that, GM. Kasi kahit sa akin, maraming na rin nagtatanong, So, slow down ang gusto niyong tawagin in Metro Manila. Doon muna tayo sa trabaho.
Yes.
Doon sa mga kailangan magtrabaho sa Metro Manila, isa po yun. At doon po sa mga taga Metro Manila na kailangan magtrabaho sa labas ng Metro Manila.
Yes, they're allowed to go in. Sabi ni Secretary
They
Anya,
are allowed.
They're
Okay.
allowed, no? Just show your ID. The proof lang na, kumbaga, ang iniiwasan natin dito, yung namamasyal lang eh. Yung walang business talagang seryoso sa Maynila, no? Yung tipong magmamall pa siya. Kaya actually, iniiwasan natin dito yung crowd talaga. Ito ang bawal, no? Kaya nga, there's some events, upcoming events, puro canceled na.
Right.
Just,
Bawal na mass gathering.
Yes.
Okay. So, if you're outside of Metro Manila, pupunta po kayo sa Metro Manila, papayagan kayo.
well, what's the purpose?
Sorry, basta sa trabaho po.
Yes,
Yun muna ang
yes,
pinag-usapan
yes,
natin. Basta may dala kayong ID. Ito pong tanong ko, sino mag-check kung may ID kayo?
Actually, ang nadinig ko nga kagabi, no, nung in-interview si Secretary Anya, they'll put some checkpoints sa mga borders no, ng Metro Manila. Kaya nga after nun, na-interview si Mayor Marcy, no, kasi yan ang mga border natin, Marikina. Ilan ang kalsada from San Mateo, Rizal, from Quezon City, going in no, to Marikina. Nandiyan ang Antipolo, border din, ang Cainta, meron yan.
Which are outside of Metro Manila.
Yes.
Hindi mo ba?
Sabi ko nga, no, even me, I'm from Marikina before, no. Yung Marikina, meron part dyan, let's say Marcos Highway. Ang Marikina, pero ang address yan sa zip code, it's
Iba na.
Cainta or Antipolo,
Apo.
no. So, yun yung pag-aayusin natin ngayon.
Okay, you talked about Marikina. Let's talk about Marikina now. Because anong nangyari po, after the President's announcement, yung Marikina po, let's talk about Cainta rather.
Yes.
The town of Cainta has been declared under quarantine. Ano ho bang ibig sabihin nito and how will Mayor Kit Nieto impose it? Lumabas po kasi ito sa kanyang Facebook page. Let's go straight to the source of the story. We have on the line Cainta Mayor Kit Nieto. Mayor Nieto, magandang umaga po sa inyo, sir. Welcome to the show.
Magandang umaga. Thank you.
Mayor, sa inyong Facebook page po, ay sinabi nyo nga, maybe it's also best that you inform the public. What is your plan there now in Cainta?
Okay. It was based on a pronouncement made by the President last night, and we fall under one condition. Ang LGU quarantine can transpire when there are at least 2 patients confirmed sa virus na to who live in different barangays. In
Tama
our
po.
case, there were 3. Yung dalawa mag-asawa who both died yesterday, and the other one happens to be a nurse who lives in a different barangay who treated the same couple. So which now mandates that I should declare a state of quarantine in the town because we fall under that category. At the moment, at 8 o'clock this morning, I already met with the whole team just to establish what kind of quarantine we shall be imposing. Kasi
Ano
ang
po?
situation by itself, quarantine says it's a restricted movement of people. And since we will be on top of it, we have to determine exactly now the parameters on how they shall move and behave. So first and foremost, yung quarantine na gagawin namin is restriction sa lahat ng walang kwentang lakad.
Restriction sa lahat ng walang kwentang lakad. Okay.
lakad.
Apo.
Okay. When you say walang kwentang lakad, this is irrelevant. This is something that you can postpone. This is
Opo.
something that can happen some other time. Okay, the primordial thing that we have to consider, however, is yung economic enterprise ng mga tao na hindi sasagutin ang sweldo nila kung hindi sila magtatrabaho. So our position on that quarantine thing for Cainta, in the absence of any parameters that shall be released by the national government, is work can still continue under strict conditions. The workplace has to be safe enough for the employees, and the employees will have to be protected when they report for
Mayor,
work.
pasensya na po. I need to clarify that. So you're going to put yung Cainta po under yung utos po kagabi, you
Yes.
fall under, dapat mag-quarantine na po kayo dahil tatlo
Yes,
po ang
yes.
inyong confirmed cases na 2 ay sa magkahiwalay na barangay. Well and good.
Tatlo.
Tatlo po, pero yung dalawa sa isang
Dalawang
barangay,
namatay.
yung nurse sa kabilang barangay. So, pasok
Yes,
na ho kayo doon. So, automatic ho ba, quarantine na?
Quarantine.
Okay.
Declaration ko, quarantine. Pasok kami dun sa conditions na sinabi ng Pangulo.
Okay, first question, sir. It's imposed when? Right now?
That's March 15. We will
On March
coincide
15.
with the date that was imposed with the President.
Okay, so well and good, sir. Tapos ang sinasabi nyo, subalit, magpapatuloy ang trabaho dyan po sa Cainta. Tama ho ba?
Yes, in
Okay.
the absence of any pronouncement from the national government contravening this policy, that is my stand on it.
Okay.
Tuloy ang trabaho under strict conditions na dapat sanitize ang lugar at protektado ang empleyado.
Ang tanong ko po, Mayor, paano ho kayo isa sa ilalim sa quarantine on May 15, pero kailangan po kasing mag-travel ng mga empleyado papunta po sa kanilang mga places of work?
Opo. Ilalabas nga po natin yung parameters kasi na ano bang uunahin ngayon natin. Kung wala pong bas-bas na nanggagaling sa taas na nagsasabi na yung gagawin namin ay mali, ito yung paraan na makakagalaw ang mga tao rito under conditions na pwede silang mabuhay ng maayos at safe.
I understand what
Kasi
you're
kung
saying.
kunyari, for example po, ma'am, ganito ang setup. Paano po mabubuhay yung isang tricycle driver kung patitigilin ko silang magtrabaho ng isang buwan
Opo.
na wala silang kakainin? Hindi naman kaya ng gobyerno sustentuhan sila for 30 days. Paano po, and I asked my wife who's actually an HR director, paano ang mga pribadong empleyado na gustong pumasok pero ayaw papasukin?
Tama.
Hindi sila sisweldo
Tama.
at
Okay.
credit. Ngayon, kung gobyerno naman na hindi magpapapasok, ayos lang sa amin kasi kaya ko silang pasweldohin dahil inutos ko na wag silang pumasok. If the employer will be more than willing to shoulder the expense on the wages, wala naman magiging problema eh. Kasi kakain pa rin yung mga tao. Ang problema, kung patitigilin ko silang magtrabaho dahil merong quarantine ngayon, hindi kaya ibang bagay na maging problema nila at the end of the day dahil wala naman sila papakain on a daily basis.
You know, Mayor,
Ngayon,
I have to
the other-
say, I understand where you're coming from. Kasi,
Yes.
pending any order from higher government, ano po, I understand
Yes.
what you're saying. Kasi, gaya po ng sinabi niyong halimbawa na tricycle driver, hindi niyo po papatrabahuhin ng isang buwan, sabihin po natin, dahil magka-quarantine kayo dyan.
wala silang kakainin.
Paano sila mabubuhay, hindi ho ba?
Exactly.
Pero,
exactly. Unless government funds that.
Yes, yes. But it's somehow, do you think about, sir, somehow that may one way or another contradict your order of a community quarantine?
Let's look at it this way, kasi 8 days na namin ginagawa ang cleansing. Papaliwanag ko lang na ang mga may sakit sa amin, hindi nila nakuha sa Cainta. Wala kaming transmission na nangyari dito sa bayan namin because we did our part and we did our job.
Okay.
Ang transmission po na nakuha ng patient number 3 namin, dahil nurse siya sa isang ospital sa labas ng bayan namin at ang ginamot niya yung 2 pasyenteng namatay na nakatira rin sa bayan namin pero naka-ospital sa labas ng bayan namin. So what I'm saying is, yung 8 days namin proved to be a successful mode to prevent the virus from
Alright.
spreading. But since there is already a presidential directive that they have to comply with, we will live with it, we will comply with it, but we will make sure naman na yung buhay ng mga tao dito rin sa bayan
Magpapatuloy.
greatly affected just because of its pronouncement that seeks to better their lives or at least secure their lives. And that is my position.
You know, Mayor, ang mangyayari nga ho dito is because, gaya po ng sinabi ni GM Jojo Garcia na katabi ko po ngayon, yung kumbaga yung implementing rules and regulations ng inutos ni Pangulo kagabi ay kailangan pa hong ibalangkas ngayong
Yes.
araw. So it's an evolving story and we'll continue to get more updates from you, Mayor. Maraming salamat po sa inyong oras. Thank you. Kay Mayor
Thank you,
Nieto.
thank you.
We'll be taking a short break. This is The Source on CNN Philippines. I want to get the reaction of GM Jojo Garcia on the plan of Mayor Nieto. Kahit na ang Cainta ay hindi naman part ng Metro Manila slow down. We'll be taking a short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, MMDA General Manager Jojo Garcia. GM, ano hong inyong palagay doon sa plano ni Mayor Nieto? We bring that up because Mayor Nieto is from Cainta. Ang Cainta hindi po bahagi ng Metro Manila.
Yes.
If we have the graphics on that, just to clarify this, there are 16 cities and one
municipality.
municipality po sa Metro Manila NCR. Ang problema ho, GM, ang Cainta,
Is border. Yeah, border siya ng Pasig and Marikina, no? Actually, yung sinabi ni Mayor Nieto, nasa guidelines yun eh. na if you have, agato yan eh, if you have 2 cases of
Confirmed
NCOV
cases.
in one barangay with different address, you need to quarantine the barangay. If you have 2 barangays, no, na merong NCOV, you should quarantine the whole municipality. So yun yung ginawa ni Mayor Neto kasi nga meron siyang positive na 2 barangay.
Tama.
Which is good. Yung slowing down na term na ginamit ko, kumbaga, why slow down? Kasi pag siya mo lockdown, hindi ka pwede lumabas ng house. No? Nandun ka lang. We need to differentiate kasi yung mga lockdown na sinasabi. One example of lockdown is in Italy, for example. No?
Yeah.
Ito yung buong region ni lockdown with 15 million people na you can go around, may mass transport, etc. Pero nobody can go in or out of that region. Yung isa namang lockdown sa Wuhan is lockdown, sa bahay ka lang, walang pwede lumabas.
Walang transport doon.
Yes, no? So I think what we're doing right now is yung design ng sa Italy na ganyan, slowing down the movement of people, no? So sabi nga, actually yan ang isang problema namin after this, we have a meeting with sa MMDA, and then bago yung, kasi we also have lots of questions. Number 1, kung slowing, wala tayong pasok sa executive, no? Paano yung mga JO?
Ano po?
Job orders natin, ano? Kasi no work, no pay sila. So paano kakain yan? Di ba?
Which was the point raised by Mayor
Yes.
Neto, hindi ho ba?
Yes, kasi nga, madami sa ating mga kababayan kasi, yung tawagin natin kung ano yung tinabaho ngayon, yun ikakain bukas.
Hand to mouth.
Yes,
Opo.
no? Hand to mouth sila. So, paano natin gagawin yan? So, yan yung actually, I'm also calling to call civil service on that one. Paano natin i-design?
Yeah, because kung meron pong pondo para tustusan sila for the meantime, whether it be full or half, I don't know,
Yes,
GM, ano po.
yes.
At least meron kayong direction
Yes.
na maaaring puntahan. Kaya lang dahil nga, it was an order last night and the fine print or the IRR needs to be ironed out
Yes.
at the soonest possible
Yes.
time. As I mentioned a while ago, this is something that will evolve in the next
Yeah.
24 hours, no?
Yeah, even the NCR mayor, no? Sabi nga ni Mayor Dino, no? Nung MMC and then sa group namin, kailangan iisa ang patakaran natin sa NCR. Kasi for example, mag-curfew ka
Hindi pwedeng iba-iba,
sa Taguig.
sir.
Tapos, pwede ka pala pumunta ng Makati, mag-bar ka doon, di baliwala rin. Ano? So, yun yung ginagawa namin ngayon. The good thing is, nagkakaisa yung mga mayors natin. Talagang nagsabi sila, isang direction tayo lahat. No? So, yun yung aayusin natin, we need na i-plancha natin. Pero important thing is, ito nga sa akin lagi, no? Yung prevention.
Apo.
How do we prevent? No? Simple lang eh. Number 1, stay at home, indoors. That's number 1. Practice crowd spacing.
Social distancing.
Social
oo.
distancing, okay? Proper hygiene.
Opo.
Yan ang napaka-importante.
I got that, sir. And
Yes.
you know, that's something we've been telling the public over and over again. The problem is, we need to know the parameters of this order,
Yes,
hindi ho ba? Ipasok lang po natin ang Marikina City. Because Marikina has 4 confirmed cases of the coronavirus disease or COVID-19. Ang mangyayari ho ba, dahil 4 na po yun, will they impose a community quarantine? And how? Oh, and how they plan to do it. We had him on the line pero nawala po si Marikina Mayor Marcy Jojo
Actually, I
Garcia.
heard him last night. No? Kasi yung kanya, isang barangay lang eh.
Yung 4?
Yes.
Okay.
No? So, and then isang address din lang. Kung 2 address yun sa isang barangay, you need to quarantine the whole barangay. If it's 2 barangays,
Yes.
saka mo quarantine the whole city.
Okay, nasa linya na po siya. Marikina Mayor Marcy Jojo. Mayor, magandang umaga po sa inyo.
Magandang umaga, Pinky.
Sir,
Magandang
clarify
umaga
natin,
sa lahat.
ilan ho ba ang kaso ng positive COVID-19 sa Marikina, sir?
Last Sunday, we have 1 confirmed case, and after 2 days, in addition to the 1 that we have additional 4. So in total, we have 5 cases in Marikina.
Stand corrected there. So that's 5. Ang tanong ngayon, Mayor, dun sa guidelines na sinabi nga ni Pangulo kagabi, 2 barangay ho ba? Taga saan? Taga ilang barangay ho ba itong 5?
Yeah, Pinky, I would like to clarify that. I have discussed this extensively with Secretary Duque and with Secretary Año. The cases that we have here in Marikina is a case of a local transmission only. This is not a community transmission. Dahil yung 5 kaso namin, Pinky, ay nasa loob lamang ng isang household.
Opo.
So what we have adopted and we are implementing now is a targeted and clustered quarantine. Meaning, we have quarantined the whole household of those 5 positive cases. Meron silang kasamang 8 pa eh. So in totality, parang 13 sila dun sa
13.
bahay.
Yes, sir.
13. And 8 persons under monitoring are all quarantined in the past 5 days in their household. And in relation to that, nag-contact tracing kami dun sa mga kapitbahay. Meron mga another 4 households kami na naka-quarantine na 5 days ago. So far, we are now awaiting for the result of the throat swabbing that we had 2 days ago. So we're expecting it to be
Today.
in today. Yeah, today.
Mayor,
So
what's
pag
the-
hindi nag-positive, that's good. Meaning,
Opo,
there's no
definitely.
community transmission. That's very good for us.
So ang tinitingnan niyo po itong itong another household na may 4 po.
Yeah.
Kapag yan ang
Actually, hindi. Ang tinitingnan namin, Pinky, 4 na household.
Sorry, 4 na
Yeah,
household,
4 na
sir.
household. Oh, that's very important. Yun ang importansya that we could, early detection is very important eh. Tapos yung testing eh. Then after the testing, we treat and we isolate.
Yeah.
Yun yung template na ginagamit natin. First, we detect, then we test, then we treat, and we isolate. Or that's the containment measures na ginagawa namin.
Yeah.
Aside from that, Pinky, we have activated our barangay health emergency response teams in the 16 barangays in Marikina. Lahat na may travel history to those COVID-19 infected countries, kinu-quarantine din namin. Meron kami 52 persons under monitoring, presently naka-home quarantine. In fact, meron kaming isang barangay nga rito, lahat ng barangay staff, naka-quarantine ngayon, 8 sila, tinake over ng city yung operation ng barangay ngayon. Kasi kahapon, na-detect namin, ito yung function ng monitoring and detection eh. Na-detect namin yung isang staff ng Senate na nabalita kahapon, napunta raw doon sa barangay na yun, nagkaroon siya ng visit doon. So naka-quarantine na yung staff ng Senate at yung buong staff ng barangay. So yun yung ginagawa namin, yung through the barangay health emergency response team, yung monitoring.
Okay, to be clear, Mayor,
Yes, yes.
hindi pa po naka-quarantine ang Marikina.
Hindi pa. Hindi kami naka-community or city quarantine sa Marikina. Meron lang kaming, to be clear, Pinky, we have quarantined 5 households. Naka-quarantine. Tapos ito, yung sa 5 na yon, yung isa lang ang yung 5 kaso nasa isang household lang. Wala namang symptoms, asymptomatic lahat yung persons under monitoring namin in the past 1 week. The past 1 week. And we're hoping that the results will be in. Kaya nga kami sa Marikina, ngayon may meeting ako sa Manila Health Tech para dun sa test kit. Hindi pa nga to out in the market, not for commercial use, wala ka mabibili. Ang pinapakiusap namin nga sa UP NIH ay maging kami, parang laboratory testing center. Para sa ganun, lahat ng persons under monitoring namin ay matest.
Opo.
Yun ang importansya ng may test. At Pinky,
Absolutely,
I would
sir.
like also to emphasize that today I have issued executive orders not only urging but enjoining mandatorily all private hospitals in the city to allocate at least 10% of their existing number of rooms as isolation areas for those who will be
Going to the hospital, sir, and wanting to be
going
checked
to the
for
hospital and will
COVID-19.
be categorized as persons under monitoring or
Okay.
persons under investigation.
Mayor, balitaan po namin na makikibalita po kami ulit sa inyo later on to find out doon po dun sa resulta nung mga test na kinonduct sa ilan pa po mga kababayan niyo. Maraming salamat.
Pinky, salamat. At Pinky, pwede ba manawagan lang?
Go ahead, sir.
Through the program, yeah. Kasi may panic buying na nangyayari sa Marikina kagabi. Ito nga yung sinabi namin sa mga kababayan namin. Huwag mag-panic buying kasi ang supply naman ay steady. At dito sa Marikina, yung price control naman ay pinatutupad nating mabuti. At yung hoarding, mahigpit nating pinagbabawal. Kaya walang ipag-aalala yung mga kababayan natin. Even yung supply natin sa palengke, kaninang umaga, nag-ikot ako sa palengke, nakita ko naman, dahil wala naman ban on the pagpasok ng mga commodities. Malinaw
Wala
naman
po.
yan eh.
Wala po.
Wala ha.
Yan
Kasi
din po
yun ang
sinabi ni
kinatatakot
GM.
ng mga kababayan. No? Si GM ay kaibigan natin at kababayan
Okay.
namin dito sa Marikina eh. So,
Sige, sir.
walang shortage na supply. Kaya walang dapat ikala.
Ayan po, galing na po
ipag-alala.
yan sa inyong mayor
Opo.
dyan po sa Marikina. Maraming salamat kay Marikina Mayor Marcy Teodoro. Again, we'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, MMDA General Manager Jojo Garcia. So food po, in and out, pwede. Walang
Yes,
problema po
yes,
yan.
walang problema.
Sinabi nyo na po yung empleyado, pwede rin, pakita nyo lang yung
Yes.
ID nyo. Paano po, other examples, GM, kailangan nyo pong pumunta sa supermarket, kailangan nyo pumunta sa nanay nyo na nasa ibang lugar, kailangan nyo bisitahin yung mga ganong klaseng halimbawa.
Actually, sabi ko, it's a case-to-case basis. Hindi naman, sabi ko, wala namang absolute. There's always an exception. Maintindihan naman yan eh. Sabi ko nga, si Secretary Anyo, napaka-ano niya. Open siya sa lahat ng suggestion, pati ng mga mayors. I just want to repeat again sa ating mga kababayan. Huwag po tayo masyadong magpanic. May OA kasi minsan di ba? Tandaan natin, sabi ng DOH, this virus is not airborne. No? Meaning, kahit meron niyang katabi mo, kung hindi mo nawakan yung liquid niya coming from him or her, at hindi mo dinikit sa'yo, hindi ka mahawa. Di ba? So, yun lang, no? Like, for example, yung sa public transport.
Yun nga po,
Yes, no?
buses,
Yes,
jeeps.
yes. I talked to Chairman Chuck Delga the other day para kung ano yung gagawin natin. Ano? Ang sabi niya nga, for example, provincial buses, madaling i-monitor yan. No? Pag sumakay dyan, kailangan lagay mo yung pangalan mo, address, and contact number. Kasi ang napaka-importante talaga dito sa virus na to, yung contact tracing kung tawagin. Na kung ikaw, biglang nag-positive ka, kailangan alam saan ka nang galing at sino yon, no? Kasi nga, kaya mabilis kumalat yung COVID compared to SARS, no? Sinabi ng isang doktor, kasi yung SARS, malakas ang mortality rate niya. Meaning, pag nagkaroon ka, mamamatay ka kagad.
So are provincial buses still allowed to enter Metro
Yes,
Manila?
yes, definitely.
Pwede.
Yes. Kaya nga, ilalagay lang, ano ba guidelines? Yun yung gagawin namin.
Okay.
Pero of course, yung public, of course, meron galing ng, pag sinabi mong Bulacan, probinsya na yan eh. Pero may tinatawag tayong commuter bus. Ibig sabihin, ito yung araw-araw na mga empleyado.
Go pa rin yun, sir.
Yes.
Okay.
Yun yung pag-uusapan. Pero ang sabi nga, kailangan lang mag-ingat. Hindi na pwede yung siksikan ng face-to-face kayo.
Yun na nga po.
Di ba? If you
And how
can
do you
wear mask.
prevent that?
Actually, siguro naman.
Wala naman kung gusto magsiksikan.
Yes, pero I think, no, sa movement ngayon, we're slowing down Metro Manila. No? Yung term natin, we're slowing down. Konti rin ang pasero. Just look at the traffic now. Di ba? Hindi sa natatakot sila or what. Kasi nga, ina-encourage natin sila to go indoors. Sa bahay lang kayo, kung walang importante gagawin, stay indoors.
Okay.
Di ba? Para at least makontrol natin.
Right.
Yung
But yung
pagka-
sinasabi niyo po, GM, na case-to-case basis, who decides on that?
That's why, yun yung itatalong namin lahat. Even me, that's my question. So.
Even,
Yes,
siguro
yes.
kahit yung pinakamaliliit, sir,
Yes.
na
I
mga
think
tanong
ang
kailangan masagot.
i-address siguro muna yung mga job orders na trabaho, yung arawan.
Yeah.
No?
Okay.
Paano yan? I think yun yung number one natin. Kasi sabi nga nung isang mayor, kausap ko nung isang araw, let's say si Mayor Vico, hindi kaya ng gobyerno i-house to house lahat at dadala mo ng pagkain.
Yun na nga po.
Di ba?
Also, hindi ho ba yun din sinabi ni Mayor Nieto? Okay, so there's a meeting. Hopefully, more questions will be answered.
Yes.
And we'll have a better understanding of this as the day progresses. Maraming salamat kay MMDA General Manager Jojo Garcia. Sir, thank you as always. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.